Thank you very much, Anne, and good morning to all of you. I'm very happy to be able to join you. Thanks to Catherine Severo for this opportunity, to Mark for joining us, Emily Hughes and the team who put it all together with GMS. So I just want to see that I'm very proud to see the 5 years of work that you have been quite driving in this period. I am very pleased to be part of the conference, as I believe that the work that you do and the work of the Global Fund itself is absolutely crucial in the fight against HIV, tuberculosis, malaria. I am excited, as I'm sure all of you are as well, to learn more about the evidence that this project has collected in terms of asking what the critical questions in technical assistance, what is working, and as the world changes, how do we adjust? We do not have time to provide anything but the most targeted, high-impact assistance to the countries and organizations we work with. And I realize that I am not just speaking for USAID when I say that this is as we are in a fight together. Looking out to all of you, I see indeed many familiar faces. I feel comforted by the fact that whether you are a member of the Global Fund Secretariat, a country representative, a consultant who has worked on the ground with this project, or a member of an organization or agency, we are here today to find out what works and put this evidence into action. As you all know, investments in the Global Fund under our current administration remains very strong. And the good news is that they are getting even stronger with a historical pledge from the United States government to contribute the $4 billion over the current pledge period, and we are not going back on it. On World AIDS Days, President Obama reiterated the United States government's commitment to an AIDS-free generation and raised the bar to put 50% from 4 to 6 million more people on treatment. Prevention and decrease in incidence will be key to turn the tide on the epidemic. And the United States remains resolute in its fight against tuberculosis and malaria as well, devoting millions through our bilateral and central programs. We are investing in country-owned institutions and programs that leverage these resources even further. Again, we are in this together, and coordination is the key. The evidence is clear. Globally, the impact of the United States government's funding when partnered with contributions from other countries, organizations, and private donors can get us that much closer to meeting our targets in HIV/AIDS, tuberculosis, and malaria. The Global Fund provides this opportunity. Our assistance to the Global Fund through projects like GMS makes those resources even more effective. So what works? I keep going back to that question, and I wish I could stay the whole day just to hear all of the wisdom that you bring to the table. I'm sorry that I can only be here at the beginning. We've learned over the years that we need to embrace innovation as part of our technical expertise and approach. It cannot be the same old workshops and PowerPoint presentations. We need to meet countries where they are and work from there. So as we review the evidence here today, my sense is that two themes will continue to surface. The first is promoting country ownership. Through a collaborative and participatory approach, we know that if the technical assistance is not owned or wanted by a country, there will be no sustainability. The consultants walk out the door, and that is the end. We've all seen this in so many iterations. We found action plans that are years old and dusting on shelves. This project's demands-driven model, in my opinion, is critical to its effectiveness. We, and I look at all of us in this room, we are not here to tell countries what they need or do not need. We are here to support. When a country needs this support, in the case of GMS, we can respond quickly. And when the technical assistance is over, the skill stays with that country through the individuals who have the right tools and systems to make grants work. And that capacity is helpful beyond the short-term purpose. The second is focusing on governance and management issues, which has been at the heart of the support work of GMS. For those who implement Global Fund grants, whether at a country or organizational level, the challenges are there, and we know this from years of working with ministries of health and social welfare, as well as partnering with the most established and most nascent organizations. Without addressing governance and management, all of the money in the world cannot make these things work. The sting of this is most immediately felt in the area of procurement and supply chain. As we are fond of saying in USAID, no commodities, no program. These governance and management simply cannot be ignored and are the key to successful grant management. And in the end, the numbers that I've been reviewing in your reports speak for themselves. This technical assistance worked with 78 countries and 360 grants, affecting over 5 billion or 25% of the same value of the Global Fund portfolio. These are not small numbers, and the impact of the technical assistance made this possible and should actually carry on. It is exciting for me to be here today as this work dovetails in our own new global health strategy framework. As I've learned more about the US government's role in supporting the Global Fund, I've been struck by the direct linkages to the principles of our strategy. For one, providing technical leadership in responding to new global health challenges. And I would say we can do this by developing new tools and approaches to address the Global Fund management issues. Or partnering strategically with a wide range of actors. Indeed, this has been about partnership. As many of you represent these countries and organizations, we are partnering with numerous stakeholders, including the UNAIDS, EIS, GIZ, the French 5% Initiative, the Clinton Foundation, CSIT, the Gates Foundation, and many, many others. Also, accelerating the development and application of innovation, science, and technology. I see this as being proactive in developing tools that are responsive to country needs. And as you have heard me allude throughout my speech, scaling up evidence-based, equitable, inclusive, and locally adapted health solutions. This is the core of what we call at USAID implementation science. This support for grant implementation really is providing assistance in management and leadership required to scale up national programs that works. And as I mentioned, this is indeed critical. In the vein of sustainability, strengthening local health systems' capacity to support partner countries' leadership of health policies, strategies, and actions is core to our work across the Bureau. As we'll see today, we are supporting local capacity in strengthening of those principal recipients, mostly national governments, as well as local NGOs, to manage programs and funds. And I would like to emphasize again, that capacity carries beyond a one project. We are promoting inclusion, gender equality, and female empowerment through working with country coordinated mechanisms to ensure that representation is inclusive of women and youth, people living with diseases, and key affected populations. And finally, very important for us in these days of budget constraints, working efficiently and being effective stewards of public trust and resources. With both CCM and PRs, we are working to ensure effective grant management and oversight. The CCM represents the nation in making sure that PRs are accountable for disease programs, and the PRs must have the systems in place to ensure efficient programming and management, as well as accountability of the taxpayers' funds. And with that, I think it's time for me to turn things over. Again, I'm very pleased to see you all here today, and it is truly my belief that if we get these things right and do what works, we will not only be more effective in our support for the Global Fund through projects like GMS, but we'll also get closer to meeting our goals in putting an end to the burden of these three big diseases of poverty. On behalf of the Global Health Bureau at USAID, I thank you all for taking the time for reflection, for learning, and for charting a new path in a changing world. Thank you very much. Thank you very much.